Welcome to our training, a parent's guide on how to count the kicks. I would like to thank our partners at IMHC and Anthem for allowing us to share with you about our amazing stillbirth prevention campaign and our life-saving app called Count the Kicks. My name is Stephanie Moody, and I am the Health Equity Coordinator with Healthy Birthday Count the Kicks. My granddaughter Luna's life was saved because her mother used our free Count the Kicks app. On her due date, Courtney thought that she was in labor, but she noticed that Luna was taking longer to get to 10 kicks. She wasn't moving as much as she used to. She called her doctor. They told her to drink water, lay on her left side, and to time the contractions. She was a first-time mom, and there's times that we can feel a little anxious about giving birth. But Court decided to trust her instincts, and she trusted what she knew was normal for Luna, so she went into the emergency room. She was able to provide the doctors there with the information that Luna was not moving like normal, and they found that there were two health issues that would have prevented our Luna from having a healthy birthday. Around 2 a.m. that morning, she was born via C-section and is now a sassy 2-year-old little girl and a big sister to her little brother Ramare. Since then, I've continued sharing my story, empowering expectant parents by teaching them the importance of counting as well as tracking their fetal movements in the third trimester. So what is Count the Kicks? Count the Kicks is our evidence-based stillbirth prevention public health campaign that educates expectant parents on the importance of tracking fetal movement in the third trimester. Our free app is an early warning system, providing expectant parents with the data that empowers them to speak up to their providers if they have a concern. Our stillbirth prevention campaign, known as Count the Kicks, came about when 5 Iowa moms endured the heartache of losing their daughters to stillbirth or infant death in the early 2000s. Through many conversations over coffee, they decided to turn their grief into stillbirth prevention efforts to keep other families from facing the pain of losing a baby to stillbirth. We have both a free mobile app that you can put on your phone, download on your phone, or we have a downloadable paper chart on our website for those who don't have access to a mobile device, or maybe you struggle with access to the internet. Someone might be asking, is learning about stillbirth important? Is stillbirth really a concern here in the United States? Unfortunately, the answer is yes. Across the U.S., approximately 23,500 babies are lost to stillbirth every year. Statistically, that means 1 out of every 169 pregnancies ends in stillbirth. That is equivalent to a busload of children every day who never make it through the birthing process. For Black expectant parents, that number is even more alarming. It's 1 in 96. Families are 10 times more likely to lose a baby to stillbirth than they are to SIDS. Counting your baby's kicks, jabs, pokes, rolls, elbows, any movement is important because a change in your baby's movement in the third trimester is often the earliest sign of distress in a baby. When you know what is normal for your baby, you can be more alert to potential red flags. You are already a great parent, and this is just a simple, free, and easy thing to do. Using the app to count your baby's kicks is very simple. It's as easy as counting to 10. Once you reach your third trimester, which is 28 weeks for a normal pregnancy and 26 if you're considered high risk or you're carrying multiples. We want to monitor those daily movements, preferably at the same time, keeping track of every movement except for hiccups because hiccups are involuntary. You want to see how long it normally takes for your baby to get to 10 movements. After a few days, you're going to see a pattern. The app will show you the normal amount of time that it takes for your baby to get to 10 movements. Now, keep in mind, every baby and every pregnancy is different. Your baby might take 10 minutes, your friend's baby might take 35, and that's okay. The key is knowing what is normal for your baby. If your baby's normal changes during the third trimester, this could be a sign of potential problems and is an indication that you as the expectant parent should call your healthcare provider. Our app is free and it's available in 14 languages. Go and download it today. It's available for Apple and Android products. If you get interrupted during a kick counting session, you can restart it. If you accidentally track a kick, you can delete it. We also have a feature where you can set a daily reminder to help you to remember to count those kicks. After a few days, you'll begin to see a pattern for your baby. You'll know how long it takes for them to get to 10 movements. You can review your kick counting history, download it and share it with your provider or with their father or with your friends. And you can also track your future pregnancies so that you don't have to create a new account every time you get pregnant. You can manage your account on multiple devices, including the Apple smartwatch. We've also added a new strength tracking feature because research shows expectant parents should also be paying attention to the strength of their baby's movements while counting and tracking the kicks. With our new strength tracking feature, at the end of each kick counting session, you're going to be asked to rate the strength of your baby's movements. If your baby's movements become weaker, it could be a sign that your baby needs to be evaluated. This new feature teaches us how to judge the strength of the movements. So you can rate the session from fluttery to fierce. Fluttery is going to be the light movements that are hard to see from the outside, similar to what you feel when baby first starts moving. Fierce is going to be the strong movements where you can visibly see baby moving around on the inside. It can literally feel like a limb is going to poke out of your belly. Simply rate the strength of your kick counting session by selecting fluttery, which is indicated by 1 footprint, up to fierce, which is 5 footprints. You can include a note detailing how the session went and what you may have noticed during the session. For this note, it just says baby felt strong like normal. Once you finalize the session, you'll see a graph. It's going to show you what your average is, as well as the average time that it takes for your baby to get to 10 kicks. If you notice a significant increase in the average amount of time where it's taken baby longer to get to 10, or you notice a decrease in the strength of your baby's movements, contact your provider right away. Reduction in fetal movement can also signal anything from low amniotic fluid to a ruptured amniotic sac to a tangled umbilical cord. If your provider's office is closed, hospitals are open 24/7, ready to serve you. The risk of not speaking up outweighs the risk of going in. We also have a new video capability to inform and educate our app users on how to count their baby's movements, why kick counting is so important, as well as a short tutorial of any new features that we have on the app. We're also excited to announce the latest update on our app. We recently launched a new resource that can be found in the menu. Our app users now have access to our new website, healthybirthday.findhelp.com. This website allows you to enter your zip code and search for free and reduced cost services that you might need, including things like prenatal care, dental care, mental health support. So maybe you're needing help with finding Section 8 housing, finding a local doula or food banks in your area. Just pop your zip code in, hit search, and you'll be able to find those resources that are close to you. Sometimes we talk with expectant parents who may not feel that kick counting is necessary. And when we ask why, we find out that there's some common misconceptions as well as outdated information and even outdated practices. One misconception is that babies move less the closer that they get to the due date. That's false. Babies don't move less, they just move differently. You might feel less sharp kicking and more rolling instead. However, if you are monitoring your baby's movements at the same time each day, it should still take about the same amount of time to feel the 10 movements. If not, speak up. You are your greatest advocate and you know how your baby normally moves. Don't be afraid to speak up. Another misconception is my baby is always active. I don't need to count their kicks. Active babies can also experience distress, sometimes quickly and without any other warning signs. So tracking your baby's movements every day takes the guesswork out of knowing if your normally active baby has slowed down. Again, if you notice a change, don't be afraid to speak up. Another misconception is I hear the baby's heartbeat on a Doppler device, so I don't need to worry about it. This is false. A change in your baby's heartbeat is one of the last things to occur when a baby is in distress, where decreased fetal movement is an early sign. Think about it like this. When we don't feel well, we're not up bouncing around. We're not cleaning the house. We move slower or less, and it's the same for baby in utero. This is why it's important to track the movements daily and speak up if you notice a change. Another misconception is baby is just running out of room. They're getting ready for birth. That is not true. Babies should continue to move up to and during birth. My last misconception is that moms should get 10 kicks in 2 hours. Again, this is false. Remember, every baby is different and you will want to know what's normal for your baby. If there's a change and you don't feel like your provider is hearing you, Follow your instincts. Go to the hospital and share your baby's kick counting data. Share those statistics. Let them see the difference that you've noticed and the average time that it's taken for your baby to get to 10 kicks. It's what my daughter-in-law did, and it saved my granddaughter's life. I hope you enjoyed our presentation today and that you'll go and download our free app. Feel free to visit us at www.countthe.kicks.org for more information. Have a safe and healthy birth.